Okay, good morning, everyone. We're about to start our study. Today, I will go through the slides that I haven't finished last time, and then we'll start a new topic. Of course, this is also related. It is also related to data collection. It's about the measurement tools. It is critically important to select suitable, valid, and reliable measurement tools. So I will spend most of the time today talk about the measurement tools, how we can check the psychometric properties. That is the term I mentioned to you last time, which indicates the validity and reliabilities of the measurement tools. Is the mic is I speak loud enough? Loud enough? Okay. So this slide, just to refresh your memory about what were we were talking last week. I talked about the natures of measurement tools and basically two big categories: self-reports and biophysiological measures. Self-reports are the one that we use most of the time in nursing and healthcare and social science studies. But of course, and last week I have went through all these with you in the lecture, and today I will uh, I will go through the biophysiological measures. Even though I say we use the self-report, the questionnaire most of the time, but it also depends on the outcomes. If your study outcomes, your dependent variables are something like physiological changes, like blood pressures, uh, stress level, the cardiovascular function, respiratory function, all this, we can't use questionnaire. Instead, we need to use some clinical investigation. So sometimes we also use measurement tools that measure some physiological changes of the participants after completing an intervention. And for biophysiological measures, we only use it in quantitative studies. We only use it in quantitative studies. So you see, I write down quantitative only, quantitative only. Before that, I missed this one. Self-report. Last time I went through the questionnaires for both quantitative and qualitative. There is one more type we call it observation. We call it observation. I will also talk about it today, and then I will go through the biophysiological measures together with you. Let me go to the observation. This one. Okay, observation is the last type of self-report approach. Observation is very similar to using questionnaires. The only difference is for using questionnaire approach, we give the questionnaire to the participants. We ask the participants to fill in the questionnaires according to the instruction, or the research team, some members in the research team interview the subjects, ask them the question, and they answer you, give you the answers for each item. For observations, sometimes we use observation instead of giving the questionnaire to the participants directly, because we think that if we give the questionnaire to the subjects, they cannot fill in a correct answers to you due to their cognitive level, due to their developmental stage. Usually we do it on children and also for elderly with cognitive problem. And another reason why we use observation instead of using a questionnaire approach, because we, especially for some studies, we want to see the behavioral changes of the participants. And we know that if the subjects know I'm checking their behavior, do you think that they will fill in the true items to you, give you the true rating? May not, may not. So sometimes we want to use the observation approach to make the measurement more objective, more objective. So for observation, how we do it, usually we video record the activities that are relevant to the research questions, like the example here, like the example in the orange box, and observational studies examining the nurse-patient's communication in ICU, examining nurse-patient communication in ICU. The outcome, I want to know how the nurse communicate with the patient and how the patient responds. So for the outcome like that, do you think that we can simply use a questionnaire to measure it? We can't. It is really difficult for us to, even for the nurse or for the patients, to raise the item. So a better way is through observation. How we do it? Occasions of nurse-patient interactions was sampled. The researchers video record part of the nurse-patient interaction during in the ward, and then take out some sections of the video. And after taking out some sections of the video, 3 minutes each, the observers, they have observers. Observers, in fact, is researchers in the team that know well about communication. They will follow pre-specified questionnaires about communication, and then they will watch the video. After watching the video, they will give rating on each item on the communication checklist according to their expertise, understanding about nurse-patient relationship. That is the way they do observations. So the first point here, video record the activities according to the research questions, like the example here. The activities that the researchers record is the nurse-patient relationship. That is maybe during the daily routine or daily care, they capture some of the moments for review. And after that, the outcome assessors, usually the research team members or some trained assistants, some trained members, will evaluate the observed behavior using checklists designed for behavioral evaluation. Observed behavior in this case, in my example here, is the patient-nurse interaction. Based on checklist, this checklist is developed by the research team. And for this example, the checklist must be related to the nurse-patient communication. And why do we need this measurement? I just mentioned to you, because we want to increase the validity and reliability of the response, because we know that some participants cannot give reliable answers, like children. Several years ago, I involved in studies about giving unstructured play to kindergarten children. You know, kindergarten children, do you think they can give you any response? They can give you response, but not what you intended to have. Okay, anything they impulsively want you to know, then they will tell you, but they can't give you an answer that is truly reflect their feelings or their experience. So in that studies, what I do is I don't give them questionnaires. Of course, it is impossible, and I use observation. I video record their behavior during the unstructured play activities, and then after that, I review. Some of my team members review the video, and then they based on the play check. I have several checklists. One of it is play, how they play during the activities, and then to see the level of playfulness of the children. So for children, we can't do that. For cognitively impaired individuals like a dementia patient, they may not able to give you valid response, so we will use observations. If the participants know they are being assessed, they will perform differently from their usual way. It is another reason why we will use observation instead. And the example here is the one that illustrates why we need observation. Do you know that if the nurse know you are doing a studies, want to know how they interact with the patient, do you think that the nurse will give you true response about their daily interaction with the patients? May not be. Or even they said it is true, it have much of subjective elements. So we want to do it in a more objective way. So we use an observation approach. But of course, you may ask me, you may think that, okay, I need to rely on an observer to rate the interaction between the nurse and the patient. If the observer has any bias on the behavior that they see in the video, would it give would it result in a biased findings? Yes, possible. So for observational approach, one of the major drawbacks would be observer bias. Everything have bias. every approach has its pros and cons. So whatever approach you use, you need to bear in mind that there must be some bias in it. So we will try to avoid it. So it is observer bias. This is what I mean, observer bias. The observer itself has some preconceptions about the behavior of the nurse and the patient. They may give a lower or higher rating. Okay, another examples about, here is a checklist and a sample checklist of for studies using observation. Like these examples, it is not a research. This checklist is not a research. It's for employers. So after you graduate, you work in a company. The supervisors will do a performance appraisal with you every year. Things that here, I also need to evaluate my performance. Also need to evaluate by my supervisor. And then this kind of performance evaluation is also a daily examples of observation approach. Your supervisors will observe your performance throughout a year, and then by the end of the years, they will your supervisors will give you a checklist, and then they will go through the checklist with you how you perform for each items. Like this example, this one the employees is John, and it is one of the section in the performance evaluation about science and technology knowledge, and there are some items here, and then Likert scales was used to rate the performance on each items. So the observation approach is not only in research, but we use it every day, especially for evaluating performance of your employees. Okay, that's all about observations. What you know is the approach. Under what situations we will use the observation approach instead of using questionnaire, and what is the potential bias for observation? That is the observer bias. Okay, biophysiological measures are more objective than self-report. Yeah, of course, it must be more objective because for the biophysiological measures, in fact, it's related to clinical investigations. We measure the waist, hip circumference of the subjects. We measure the blood pressures. We take the blood and measure the enzymes level in the blood. We measure the glucose level in the blood. All these are very objective. And the validities of the data depends on the performance of the machines. After completing this PowerPoint, I will talk about another topic, measurement tools. For that topic, I mainly focus on the validity and reliabilities of assessment scales. And for biophysiological measures, we don't use questionnaires, we don't use checklists, but we still concerned about the validity of these findings. But the way we check the validity of biophysiological measures is totally different from those collected by questionnaires. And what we concern most for measuring biophysiological measures is the performance of the machines. Like the simple example is the blood pressure machines. The Dynamed, we use the Dynamed to measure the blood pressure, right? But how do you know this blood pressure machine is reliable and valid? How do you know the blood pressures measured by that particular machine can reflect the real blood pressures of the patients? Of course, we have some way to check the validity and reliabilities of these machines. And the terms we use, I highlight in the orange box here. For all, if you include the instruments you use in your studies is machines. We usually read the specifications of the machines. For every machine, it comes with a specification. And the specification means how accurate and reliable of the machines. It will give you all the data there. There are two terms, just for your reference, that we commonly use to determine the validity of the machines. We call it sensitivity, specificities. Okay, sensitivity and specificity. I will not talk about it in details in this course. because it is not related to those it is not related to questionnaires, but for machines only. And if we want to make sure the machine you use are accurate and reliable, and before you do the measurements, we must do one thing. That is the second point in the orange box, calibration. Calibrate is the term used to describe how we adjust the measurement in the machine to make sure it is correct. It is correct. And also, we need to use the same machine for each measurement to make sure there are no discrepancy, or the discrepancy between machines will not affect the true readings. And for physiological measures, we have two main types of data we can collect. The first is in vivo. In vivo means performed directly within or on the participants, like anthropometric data, hemodynamic data. We call it in vivo. We don't need to take blood. We don't need to take the body fluids of the subjects. We just do measurement on the subjects. Anthropometrics. Can you give me an example of anthropometric data? We are used to do this for health promotion and health education activities. Body weight, yeah, BMI is a very common example. What else? Waist hip circumference. 嗰個腰圍比例嗰啲又會啦。Fat deposition, we will do that. Okay. Hemodynamic, many vital signs. All vital signs are hemodynamic. BP, pulse, SpO2, respiration, temperature. All this hemodynamic. Another types of biophysiological data we can collect is in vitro. That is something related to blood, serum, body fluid. And we will collect this, and then the analysis will be conducted by some laboratory technicians. Like we collect biomarkers for cardiac case, blood sugar levels for DM patient, bacterial counts. For example, maybe your topic is about chronic wound or some DM wound, so you want to check the infection rates after receiving some intervention. So you check the bacterial counts. Okay, other practical issues to be considered under data collection. Throughout the whole lectures about data collection this week and up till now, I talk about the methods of data collections, and I emphasize the importance of valid and reliable measurements. And this part I will further talk about it today. And some more things we need to consider when we do the data collection. The intervention protocol. That is, if your studies is an interventional studies, not for all studies. For observational studies, we don't have intervention protocol. Intervention protocol means like a guideline. How you do the intervention. My study will conduct a mindfulness studies, a mindfulness intervention on my school age children. So how you do that mindfulness intervention? So we need a guideline to put down every details about the mindfulness intervention, like how many weeks you need to complete the intervention. I need 12 weeks. That is 3 months. Every week, how many sections? I have one section only. Each section, how long? 1.5 hours. Is it a group intervention or individual interventions? Mine is a group intervention. How large is the group size? We need to put down all these details. And what are the activities within that 1.5 hours? And how many trainers? What is the quality? Any qualification requirement for the trainers? How many trainers? All these are the details. So you need to put down every details about the intervention in the intervention protocol. What I mean protocol, like guideline. And the next is part training to data collectors or outcome assessors. We need training. For questionnaires, maybe simpler. I give the questionnaires to the subjects. If the subject is cognitively intact and developmentally appropriate, they may be able to return to fill in the questionnaires themselves and then return it to you. But in some case, if we need the outcome assessor to do interview, to interview the subjects and then collect the data, then we need to train the outcome assessors, especially if you have more than one, because we want to make sure each outcome assessor understand each items in the checklist consistently, so they will not interpret the items in different way to the subjects. Okay, or if your studies involve using machines, using EEG or ECG, we must train the outcome assessors, because we want to make sure the outcome assessors is competent enough to handle or to manipulate the ECG or the BP machines, so they can get the results correctly. And also for some clinical investigation like MMSE. MMSE is not a kind of machine, right? We just do, we ask the subjects to do some exercise, but it needs the physicians, that is the outcome assessor, to instruct the subject to do the test for the MMSE. So we need to make sure the outcome assessor know how to instruct the patients to do each exercise correctly. Otherwise, we can't get a correct result. Standardized data administration methods. Standardized data administration methods, it is important and crucial, because usually we collect data more than once. At least for interventional study, we have pre-test, post-test, we have 2 measurements. So the way you collect data for these 2 measurements must be exactly the same. For example, if you use a paper questionnaire for both measurements, for both measurement points, you need to give paper measurements. Okay. If you use an online approach, then you use the online approach. Okay. Paper versus online measurement, self-administer or interview, all these must be consistent among different measurements. Closely monitor the intervention implementation. Yeah, after you plan, you have the protocol, even though you have written down, state everything in the protocol, but will the trainer do the same for each study groups? May not be. So we need to train the trainers before doing the interventions to make sure the trainer do everything stated on the protocol, and each trainer within the team will do the same. So it spends much time to train the trainer, in fact. So doing research is really time consuming and quite exhaustive. Other forms, for all the points I just mentioned to you, if you do all these points well, control all these points well, then it can increase the validity of the study findings. That means less error in the findings. And some more things about ethics. In doing research, as a nurse, we need to be ethical. As a nursing researchers, we need to be ethical as well. So we need to adhere to all the research ethics when we do research. And the first and the most common one that you must know is we do not force our subjects to participate in our studies, but we need them to understand the study first. So we give them an information sheet, and in the information sheet, we state the purpose, we state the benefits, potential harms, and also when and where they can get help if they have any problems about the studies. And after that, we need them to sign consent. We need them to sign consent. And Eliza will talk about it later on in week 14 about the research ethics. But at least at this moment, you know that we cannot force our participants to stay in the studies till the end. But and before that, they must sign consent. And there are different types of consent form, and Eliza will share with you more later. And also we need to prepare the advertisement to recruit participants, like poster. If you go back to KPC, you take the left, you will see there are many posters inside the lift, and some is some teachers' studies. And also, and maybe now you need to post on Facebook or Instagram, some social medias to promote your studies. Okay, key points for these lectures. You must be able to differentiate dependent, independent, and confounding variables. These are three major variables in all research. And also the operational definition, that is how we measure research variable. There are 4 levels of research measurement. Whether the outcome, which level your research variable belongs to, it all depends the measurement tools. I gave you some example last time, the stress level measurement, and also the geriatric depression. And for self-report, you must know well the structured interview and the self-administered approach, that is using the questionnaire approach, and also the major drawbacks of self-report, social response set biases. Okay, that's all about data collection. Let's start our topic today. Another topic today, reliability and validity of measurement tools. It is part of data collection. It is I may say it is an extension of data collection. We collect data. We need measurement tools. We need measurement tools to collect the data to measure the outcome. And another terms to describe validity and reliability is psychometric properties. I showed you this term last time. Psychometric properties. This is one of the slides I captured from the last lecture. Do you see this term? Psychometric properties. Okay? Psychometric properties is about validity and reliability. And this slide is about the measurement error. Just want to refresh your memory about measurement error. In data collections, it's the sections that will have much error as compared to other sections. Measurement errors. In measurement errors, we cannot control we cannot control random error. In measurement error, there are 2 types: systematic error and random error. We cannot control random error. You can see the pictures here. For random error, it's scattered around. We don't know when and where it appears, so we cannot control it. But for systematic error, we know where is it and when it appears. So we must think of some way to control it, to minimize the measurement error as a whole. The more the measurement error, the lower the validities, the validities of the study findings. So that's why we are really serious and cautious when we plan our data collection and choose the measurement tools. Another graphical illustration to let you understand more about reliability and validity. In this dashboard, no validity and no reliabilities, because all the dots are scattered around and not focused on a specific location, specific areas. It is not valid and not reliable. For the dashboard, valid is at the central. If the dot can appear at the central, it is valid, but it is not in this case, so it is not valid. It is not reliable because the point are scattered around, not in a specific region, so it is not reliable. For the second one, it is reliable, but not valid. Why? Because the dark spot is not at the central, so it is not valid. But why we say it is reliable? Because all the dots appear in a specific region each time. So this person, it is reliably focused on a specific region, but it is not in a correct location. And the last one is valid and reliable because each time the dark spot is focused on nearly the central part, and also each time, and the dot, even though some are a bit away from the center, but still within that area. So we say it is valid and reliable. Same concept applied to measurement tools. We need them valid, mean it can give true readings. It can measure my blood pressure, my real blood pressures. And at the same time, if I repeat the measurement 10 times, it also gives the same or similar ratings. So it is the concepts of valid and reliable. For this one, validity. Another term we describe validity is accuracy. 準唔準確嚇？準唔準確 ？Accuracy, whether it can truly measure, it can give a true measurement, true reflection of a specific outcome. Reliability means precision. Precision. We repeat the measures several times. Is it give the same rate to same numbers? If yes, it is reliable. It is reliable. Like the example here is about body weight, measuring body weight. I want you to make a guess. There are two scales here, scale A and scale B. Which scale is valid? Which scale is reliable? We check the A first. Amy's measure its body weight 3 times with scale A, and the reading is 50, 50, and 50. Is it valid? Is it valid? The actual body weight is 55 for Amy. So it is not valid. It is not, but it is reliable because it gives the same body weight each time, 50, but it is not valid. How about B? Is it valid? How about B? Is it valid? No, it is not valid. It is not valid as well. And although it is not reliable because it cannot give 55 for each measurement. And at the same time, the reading among these 3 measurements is fluctuate, 55, 60, 50, right? So it is scale B is not valid and not reliable. So you can see from this example, do you want your measurements valid or reliable or both? Both. We want our measurements have both valid and reliable. Not either one. We need both. So when you read your articles, you have 3 articles with you now. You're doing the group project. And I still remember one of the questions in the EPHPP is about whether the data collections is valid and reliable. You need to go to the outcome measures, the section about outcome measures to check whether the measurement tools is valid and reliable. And today, I will teach you how to read the results of those tests. We have specific tests to test the validity and reliabilities of measurement tools. What I mean measurement tools is scales, checklists, okay? Not machine, not machine. Okay, factors affecting the reliability and validity of measurements. There are many reasons. There are many factors that may affect the validity and reliability of measurements. The validity and reliability of measurement tools is one of it only, and it is the key one. It is the key one. And so I highlight here the last point, measurement tools. The validity, the reliability of the measurement tools is a core factors that may affect the qualities of the data. But apart from it, still there are other factors affecting the validity and reliabilities of the data. For example, the above 4 points, format of study instrument used in each measurement. Whether you use an online format or paper format. What I mean format is the consistency of the format. We have at least 2 data collection times if you do an interventional studies. So whether you use a consistent format for each time, each data collections, it can be an online form, it can be a data form, whether it is a verbal or written format. What I mean verbal, you ask the questions and then the participants answer you. You help the participant to write down the answers. This is a verbal one. Self-administer or interview. So the format, whatever formats you choose, it must be consistent. That is the key. Another factor is environment. The environment will affect the concentrations of the subjects. Once the subject being distracted, they may give you a wrong answers. Okay, so noisy versus quiet environment. Another thing about the environment is whether the subjects feel secure in that environment. Will their response being seen by other people? So usually for doing the checklist, now we use the online format. the subjects can do can complete the questionnaires wherever they are. So it eliminates the problems of the physical environment. But in the old days, we just have a paper format. Usually, we try to eliminate all the disturbance in the physical environment. We will ask the subjects to go to a room, and then they do it there. Time of the day. If the data is, I mentioned it last time, if the data is sensitive to time, like blood pressures, or even stress level, then we will try to fix the measurement at a specific time of the day. Outcome assessor, the qualities of the outcome assessor, whether they have sufficient understanding about the test, and whether they are capable to explain the answers to the participants correctly. So that's why we need training. We need to train the outcome assessor. So about the measurement tool itself, there are two, usually in a measurement tools, there are two parts: questions. If you're not sure, if you still remember, I share with you one scale, perceived stress scale. Do you still remember it? PSS is a very common and popular scales we use to measure the stress level for adults. There are only 10 questions there, and it has already translated into many languages, including Chinese. And for this, there are 10 questions there, 10 questions, or we call it 10 items. Whether that 10 items can really reflect stress, this construct, this concept stress, we need to check it before we use this questionnaire. So appropriateness of these questions is essential for the validities of the measurement. Apart from the appropriateness of the questions, the readabilities include clarity and language. Whether it is readable to the participants is also essential. I say that PSS, perceived stress scale, is for adults. If you want to check the stress levels for adolescents, do you think that you can use the same scales? May not be. If for late adolescents, 17, 18 years old, maybe okay. But for young adolescents, because the adolescents range from 10 to 19. If you focus on young adolescents, 10, 11 years old, they may not be able to understand the questions. For such case, we may need to develop another scale specifically for young adolescents, for children and young adolescents. Or you want to modify the adult versions into for young children, for children and young adolescents. That is about the validities of the questions. Questions, two parts, whether the questions, the 10 questions in the perceived stress scales are really talking about stress. We need to check. And whether the questions, the wordings, is comprehensible, can be understood by the participants is another issue we need to check. Okay, second things we need to check is the rating scales. For the perceived stress scales, for each questions, we give them, the participants need to rate their stress, their agreement on each item using a rating scales. As far as I remember, it's Likert or numerical rating scales. I can't remember it. But anyway, whether the rating scales is comprehensible to the participants is another issue that we need to consider. Last time I showed you different rating scales. Do you remember that? Some for children, some for elderly, some for adults. Okay, so depends on your the cognitive level and also the developmental stage of your participants. You need to check whether the rating scales provided in the scales is appropriate to your subjects. For the types of validity and reliability tests that commonly seen in research paper, I summarize them here, and I will go through each one by one. For validity tests, there are two types. One, the first is content related. That is to check whether the questions in the scales really refer to the concepts. For example, the perceived stress scales are those 10 questions all related to stress? Would there be some of them is unrelated to stress, talking about other things? Of course, ideally, we want that 10 questions are all related to stress because this scale is about stress, okay? And we have some way to check. Face validity, content, and construct validity are three you will see in research paper. And among the three, the weakest one is face validity. Later on, you will know why it is the weakest. And the strongest one will be construct validity. What I mean weakest and strongest is whether the test is powerful enough to inform the researchers about whether the questions truly reflect the construct, okay? Another type of validity is criterion related. Criterion 條件嘛, okay? There are two tests here, predictive and concurrent. Sometimes we develop the scales because we want to know because we want to measure the stress only, but not other things. And sometimes that's why we need content validity. And sometimes we develop the scale, we still want to know whether these stress scales can predict something else. What I mean something else is something also related to stress, but not exactly stress. For example, stress may be related to anxiety level, right? And may be related to depression level. Okay, and this is what I mean. Sometimes we develop the stress scales. We also want the stress scales be able to predict some other concepts, some other variables that is related to one another. We can use the predictive validity and also the concurrent validity. I will talk about it later on. And for reliability, there are mainly three types of reliability: test, retest, parallel form. Parallel form is commonly used in teachers because we allow students to apply for supplementary exams if they are sick on that day. So now I usually develop more than one test paper because every semester there must be some students, a few of them cannot attend the test on a particular day. So we need to develop another test. And I, as a course coordinator, I need to make sure both tests are comparable. Both tests are comparable. So I will use the parallel form approach to make sure both are comparable and both are reliable. And another reliability test is internal consistency. Maybe test, retest, and internal consistency are two reliability tests that commonly found in research paper. And under internal consistency, we have cone batch alpha, we have split half. Okay, let's start with validity. Content related. Face validity is the weakest. Why I say so? Because you see the first point. The extent to which a test or a measure appear valid on the surface to assess the variable on the surface only. What I mean on the surface is because for doing a face validity test, we only include some layman to check whether the 10 questions is really about stress, but not from expert. Second point, a subjective and non-expert judgment. That's why I underline it. It is a subjective and non-expert judgment about whether the content, that is the questions in the scales, seems appropriate and relevant to what exactly want to measure. And usually conducted by non-subject specific people. What I mean non-subject. For perceived stress scales, the content, the subject is about stress. But if I want to check the face validity of the perceived stress scale, maybe I just recruit some of you here, and then you tell me whether these 10 questions related to stress. That's all. You are not subject specific. You are not researchers or scholar in stress, right? But I still recruit you to check whether the questions on the perceived stress scales looks related to stress. That is how we do it. This is the weakest way to demonstrate the content-related validity. You can imagine, I invite you to comment on whether the 10 items are related to stress. Do you know, I think all of you have stress, I also have stress, but do you know what stress exactly refer to? Do you have confidence to tell me you have 100% confidence? You have 100% understanding about what stress is about? All of us experience stress. But can you tell me what stress exactly is? Do you think you can tell me? You can't. You can't. I think you can't. But we can feel it. So that's why it is weak, because we don't invite experts to do the face validity, but only some laymen, like all of you here. But you may ask me, if it is weak, why we still need this approach? We need this approach because sometimes we cannot do some more stringent validity tests. And the advantages of doing face validity, at least, even though it is not the most valid one to inform whether the 10 questions is all related to stress, but at least we know that the layman or the participants understand these 10 questions. At least they understand these 10 questions. Maybe I'm now doing a studies about stress on about the stress level of nursing students. I use the perceived stress scales. I want to know whether you understand these 10 questions, whether you also think that these 10 questions is related to stress. If you don't think these 10 questions is related to stress, when you fill it in, do you think you will do it seriously? No, you won't, because you think, oh, it is irrelevant. Why Anson's asked me to fill in this question? It's not related to stress. So there is some, that's why we still want to do face validity. But you need to remember is, yeah, it is easy to do. And the advantages of doing so is at least the participants think that the questionnaire is relevant to the measurements. But the weakness is because it is not commented by experts in stress. So the result from my participants may not be able to accurately reflect whether these 10 questions are totally explaining stress. Some example here. The participant look at the happiness scale. Maybe now the scale is measuring happiness. And I asked some of the participants to comment on the appropriateness of these questions, whether these questions are related to happy. They read the item and decide that the item seems like a good measure of one's happiness. And then next is about a self-compassion scale. 自我關懷啊 self-compassion 即係 we like now many research talk about self-compassion because of the high stress, high anxiety and depression levels in people of all ages. And the participants find that some of the questions ask about self-directed learning, which is totally different from self-compassion. So if the participants be able to identify some questions that is about self-directed learning, totally irrelevant to self-compassion, then we will look into that items to see whether it is really irrelevant to self-compassion, and we will take it away. The second test, validity test that I'm going to share with you is content validity. Content validity is much better than face validity because we invite subject experts to review the questions in the questionnaire. So you can imagine, at least because they are subject experts, they know well about stress. They know well about stress. So they are able to comment whether the questions on the perceived stress scales are really talking about stress. Maybe at the end, they comment to you as that 10 questions is all relevant to stress, but it cannot fully reflect stress. They need more item. They want more item. They can give you some such suggestion. This is content validity. How we do it? The content validity of second point, the content validity of a scale is determined by expert judgment. It is the key difference between face and content validity. And the judgment is carried out by a panel of raters. Remember, it's not only by one expert. We need a panel, a group of experts, about 3 to 5. of them who familiarize with the variables being measured. Each expert rater will rate all items in the scale independently and give a rating to each item based on his level of agreement. And so before we invite a group of experts, and before that, the research team need to develop a checklist to include all the items that we want the experts to comment on the scales. And what are these items in the checklist? Readabilities, whether the questions, the wordings, the sentence is comprehensible to the subjects. If your subject is adult, you need to tell the panels about your subjects so they can rate on the readability. Clarity, it is clear enough to deliver the message. Would each rater have different understanding on the same questions? If yes, it means that the wording, the description of that particular questions is not clear enough and invite different understanding. Appropriateness. Appropriateness refers to whether that questions is really about stress. It's really about stress. Comprehensiveness is comprehensiveness means whether these 10 questions can fully cover the concept stress, can fully cover the concept stress, whether extra item is needed. Sometimes they will say more item is needed, and sometimes they will say some of the questions are duplicate. They ask participants the same thing. It may not be necessary to have 10 items there. Maybe 5 is sufficient. So it is content validity. And after all this, we will review the comments of each raters one by one. And then at the end, we will give an objective index to enable the research team to determine whether the content of these scales are valid enough. We will calculate an index. You don't need to know how to calculate the index, but you need to know the cutoff for acceptable validity. And this index, we call it Content Validity Index, CVI. Maybe some of you have already encountered it in your manuscripts. They talk about CVI, content validity. And for 3 to 5 experts, usually we invite 3 to 5. Of course, you can invite more. And for the CVI, the range of the CVI score is from 0 to 1. Closer to 1 means better content validity. If you have 3 to 5 experts, it should be near 1. Not exactly 1, but near 1, maybe 0.9 or 0.9 something. Then it is an acceptable CVI. Acceptable CVI means that the questions in the scale is sufficiently good and appropriate enough to reflect the construct. Okay, convergent validity. Convergent, the third validity. Convergent validity means the extent to which the two scales measuring the same variables are highly correlated. What does this sentence mean? I said perceived stress scales is a very common and popular scale for measuring adult stress, right? So we call it gold standard. Gold standard. For all new stress scales, if you want to develop a new stress scales, then one thing you need to make sure is whether this new stress scale is comparable to the gold standards. Otherwise, no one will use your new stress scales because they may think that, okay, I have a PSS, I have a gold standard here, why I need to use yours? So if you want to convince others, my stress scales, the new one that developed by myself, by my team, is comparable to a gold standard, then other researchers will consider to use yours. So that's why we need convergent validity. For content validity and face validity, we cannot demonstrate it. For content validity, we can only demonstrate to other researchers, yeah, these new scales, the context is relevant and appropriate. The questions is relevant and appropriate to stress. But you cannot demonstrate to other researchers that your scales, your new stress scales, is comparable to a gold standard. So that's why we need convergent validity. Look at the pictures here before reading the sentence. Look at the pictures here. There are two circles here. One of it is perceived stress scales, gold standard. Another is new stress scales that developed by you. Maybe you want to make another stress scales. You don't want to only rely on the PSS. And after you developed the new stress scales, then you will recruit a group of subjects, maybe your classmates, to fill in the new stress scales and then the perceived stress scales at the same time. And after that, I have both sets of data. One is from the new stress scales, another is from the perceived stress scales. Then I do an analysis to compare whether the two sets of data are comparable. Or in statistics, we call correlate. We call correlate. Do you see the term here? Correlate. We don't say consistent in data analysis. In statistics, we call it correlate. So later on, you will see in my slide, I always say highly correlate. It means the relationship between the two sets of data are highly consistent. Okay. So from the figures here, if I do it in this way, after doing the analysis, I in fact check the correlations of the two sets of data, and the symbol for correlations is R. From the box here. From the brown box here, I provide you additional information about the statistical approach, correlations. These are correlation tests. In fact, is a kind of correlation test that I will also mention it in the lecture about data analysis. And we use either Pearson correlation coefficients or Spearman-Franks correlation coefficients to do this analysis. For all questions, for all research questions about correlation, about relationship, we'll use these two tests. I will not elaborate how we use it today, but later on in the lectures about data analysis, I will talk more about it. I here just want to let you know, after collecting two sets of data, we will compare whether these two sets of data are consistent. And in statistical terms, we call it correlate. And we have correlation analysis. And for correlation analysis, we have two tests. I state here that we commonly use for doing the correlation analysis. More importantly, you need to know how to interpret the R. R is range from 0 to 1. The higher the score, that means near to 1, the higher the correlation between the two sets of the tests. For convergent validity, because I want to demonstrate my new stress scales is comparable to perceived stress scale, so I want the R to be as high as possible, Yeah, this is convergent. It measures the new scales that can measure the variable of interest by comparing with other similar scale. And the last point, higher correlation, high R value between the two measurements indicate a better convergent validity. The higher the R, the better the convergent validity. That means the two sets of data are higher, have a higher consistency. Discriminate validity. The last validity test for content validity. After I develop a scale, I want to know whether it is comparable to a gold standard. Simultaneously, I also want to know whether my new scale can differentiate from other unrelated variable. For example, stress again. I develop a stress scales. I know I do a convergent validity. I know it is comparable to a gold standard. That's good, right? I can convince others. Use my scale because it's comparable to the gold standard. But another question that other researchers will ask you is, whether you said your scales is measure stress, okay, but would it be possible that your scales, to a certain extent, will also measure something about anxiety, something about psychological distress, something like that? Because they are related to stress. A person with stress, they may have a certain level of anxiety as well. Their psychological well-being may also be lower. Would your stress scale mix up with those of these variable? And so at the end, your skills is not only measure stress, but also anxiety and psychological distress. They will ask you something like that. So how you convince them that my skills is only measure stress, not other related or associated variable? How can I answer them these questions scientifically? Not from your mind, not subjectively, scientifically. We need to do discriminate validity test. We need to know discriminate validity test. What discriminate validity test means? The extent to which the two scale measuring two different variables are correlated. Like the example here, another two circles. One is, now this time is not stress. I have a scale called social desirability scales. Social desirability means to what extent a person concerned about whether they can give people a good impression. Social desirability, whether they can give good impressions to other people. We have such a scale. It is a kind of personality scale, social desirability. So for this scale, I developed these scales because I want to measure the concept social desirability, but not other related personality. So if I want to demonstrate to other researchers that my skills only measure social desirability, but not other personality trait, I need to do discriminate validity. How do I do it? I have a social desirability scale, and then I need to find other personality skills, like openness to experience, neuroticism, that is totally different from social desirability. And then I recruit a group of people, maybe all of you here, do the social desirability scale, and at the same time do the neuroticism and openness to experience scales. And after that, I have two sets of data. One for the social desirability, another for like openness to experience. And then I do the correlation. Same test, the PSM1, SPMN1. Same correlation test as this one. So I saw correlation, R again, same test. After doing a test, what will you expect? If you want to demonstrate to others that my social desirability scale is only measure social desirability, but not other personality trait, what do you expect about the R? High? Do you want a high R this time? No, of course not. High R means the two scales, the two sets of data are highly correlated. We don't want that. If you get a high R, that means your social desirability can also measure openness to experience. That means your scale is not specific to social desirability. Then it will be a disaster to you because you need to review the scales again, to review all the questions again. So for discriminate reliability, we want a low R, as low as possible, because it can demonstrate that the social desirability scale is distinct from other personality scale. If you have such results, then you can convince others scientifically that your scales is only measure social desirability. Okay, criteria related. I mentioned 4 validity tests for content validity: phase, content, convergent, discriminate. Now I talk about criterion related. Criterion related, we have some criteria. When we develop the scales, we, to a certain extent, we want to know whether my scales can predict something else. First point, the capabilities of a scale to predict, for predictive validity, the capabilities of a scale to predict future outcomes. That is not now, maybe 2 weeks after, or 1 year after, or after you graduate, which should theoretically be connected to the variable measured by the scale. Okay, you see, we see the diagram again. For predictive validity, we usually do it. It is common to do it in university, because not sure in Hong Kong, but in overseas university, they like to do some admissions test. They like to do some admission tests. Why they do it? Because after they got the test, they want to predict whether the student this year can have a good result, have a good GPA or not, or they want to use their admission score to predict whether they are able to get a good employment after the studies. So you see the diagram here. Now there is another new academic year, and the college have recruited a group of students already, and all of them need to do a college entrance test. All of them need to do it. And the purpose of developing these tests is because the college want to know whether the score can predict the first year's GPA, So now we ask the students to do the college entrance test. For example, I recruit 13 nursing students, and then I ask them to do this test at the time of admission. And after one year, after 1 year, I got the GPA of the students. So I have two sets of data again. First is the admission score, college entrance test score. I collect it at the time they admit to the college. And the second data, I have it after 1 year of their admission. I got their GPA. And then I do a comparison to check their correlation. Again, the same test, correlation analysis again. What do you think this time? If I want the college entrance test can predict the GPA, do you think the R should be high or low? The R should be high or low? Should be high. The higher the R, the more the correlation between the entrance test and also the GPA. So for this example, the predictor, the test, I want to predict the year 1 GPA is the admission score, the college entrance test score, and the predictor and the criteria here is the year 1 GPA. I want this test be able to predict the performance, academic performance of these groups of students after 1 year. So it is predictive validity. We have predictive, we have concurrent. For concurrent validity, we want the scales to be able to predict something at present, but not in the future. We call it concurrent. Concurrent is the same time. In this diagram, you see, I recruit a group of nursing students again, and I have a stress scale, perceived stress questionnaires. It's a new scale. I want to know whether these scales at the same time can also indicate whether my subjects have any anxiety or depressions. So if I want to demonstrate the concurrent validities of my stress scales, first, the subjects, the nursing students, again, need to fill in this perceived stress questionnaire developed by me. And at the same time, they need to fill in the anxiety and depression scales. So if I do it in this way, the predictor is stress. Whether my stress scales can predict something at present. And this criteria is anxiety and depressions. Some researchers will use another stress scale to test the concurrent validity. But most of the time, because we want to predict something related at present, so we will use other associated variables rather than the same variable. So the criterion here is anxiety and depressions. So after that, I got two sets of data again. Then I will check the correlations of these two sets of data. Again, we use R. So do you want a higher R or lower R? Concurrent. Do you want a higher R or lower R? Higher, because I want to demonstrate that stress can also, to a certain percent, stress can also predict whether the subjects have anxiety or depressions at present, not in the future. So it is concurrent validity. So the last point here, higher correlation between the two measurements indicate the scale has a better predictive ability to other outcomes at present. So the difference between both predictive and concurrent validity is criterion related validity. But for predictive validity, is predicting something in the future, not at the same time. And concurrent validity is want to predict other associated symptoms related to stress at present. It is the only difference between the two. Okay, that's all about validity. And all the tests I mentioned to you, you will come across in the research paper. So I hope after this lecture, you will know what are they when you come across in the research papers, and you know the validity of these of the scales used in the studies. And the second half of the lectures is about reliability. Reliabilities, we have four. I will introduce you 4 tests. The first is test retest. Test retest is a very common and popular test, and you will see them in most of the paper. What reliabilities means? The agreement of the 2 measurements taking place at 2 different time points by the same group of people. You need to know the process. By the way, you need to know the process of conducting these validity and reliability tests. Okay, you need to make sure you understand. Not difficult. It's very simple. It's very simple. But you need to know well the differences between them and how to conduct the test. For test retest reliabilities, as the term suggests, we do the test twice at 2 different time points by the same groups of people. Usually, the interval of the 2 measurements are 1 to 2 weeks. It seldom takes longer than 2 weeks, because longer than 2 weeks, there may be other factors that will affect the subjects and make them give a different score. So we usually don't extend the time to more than 2 weeks. Look at the diagram here. If I want to do a test retest reliability, I recruit a group of students or a group of participants, and then now I need them to complete the technology literacy scale, because this time I have a technology literacy scale, checking the technology, the awareness of technology in the participant this time. Now I ask them to fill in these technology literacy scales, and after 2 weeks, I ask them come to me. They come to me again and fill in the same scales. So I have 2 sets of data, right? First one now, and another set is 2 weeks after. And then I do a comparison. I do the correlation analysis again. So you see, all the comparisons is about correlations. We do the same test, Pearson or Spearman. We use the same R. We determine the R. So if I want to demonstrate the retest reliabilities of this technology literacy scale, what do you expect the R? High? Do you want a high R? Yes, I want it high. I want a high R this time, because if I got a high R, it can tell us that the test retest reliabilities of this literacy scale is good or even excellent. Even excellent. And the high R means that the test retest means that, because I do it now and then 2 weeks after, it means that the item is the item and also the rating scale is good and appropriate enough to reflect the true literacies of the subjects. So that's why even now or even after 2 weeks, the score are highly similar. Parallel form reliability. I think doing research, in the scope of research, it is not a very popular test in research, but in education it's popular. It's just explained to you. Teachers usually develop more than 1 task paper to cater the needs of the students. But we want to make sure the fairness and all students receive a paper that have a similar content and similar difficult level. So we need to do a parallel form reliabilities. And there is another term to describe parallel form reliability: equivalent forms. Some books mention equivalent forms is the same as parallel form. What is this? Second point, create two comparable tests or scale for the same variable. Maybe this time, because my course is nursing research, then I need to develop a test about nursing research. So I need to develop two comparable tests for the same subjects, nursing research. By developing items that address the same subjects, nursing research. Wording, sequence of items could be different, but referring to the same variables. Wording, that means the contents, the sequence of the items should be similar between the two. It can be different, but also referring to the same thing. So when I develop two sets of paper, I need to make sure the content that I put down on the key points each week appear on both papers. I cannot have content that is out of the key points because I want to make sure the fairness between the two tests for the people attending two tests. And also I need to make sure the two test paper address the same set of nursing learning outcomes because you have a course description form. It has several learning outcomes you need to achieve after this course. So for the two sets of papers, we need to demonstrate. I need to demonstrate that the learning outcomes appear in both sets of paper with the same numbers of questions. I also need to make sure this. And also for the format, if this time my tests have MCQ, have fill in the blanks, have short questions. For another test, it also have MCQ, fill in the blanks, and also short questions. The numbers of short questions can be different. The numbers of short questions, the number of multiple choice questions can be different. But I also should have should have the same sections there. If I want to check the two tests, I have two nursing research tests, and I want to check the two tests, like here. So I will recruit some students. I will recruit some students to help complete the test. And the groups of students will complete both the first and the second test, And then I will again do the R, compare the two sets, do the correlation analysis, And of course, if I want to know, if I want these two tests have a higher parallel form, the R should be high again. If eventually the R is low, then I need to develop another test. So it is, last point, it is common in education to create more than one multiple test paper with equivalent levels and content. Internal consistency. Another terms we describe internal consistency, inter-item reliability. What inter-item or internal consistency means? Use the same example, the perceived stress scales. I have 10 items there. For test, if I do test retest, reliability or parallel form, I only know whether these 10 items or the rating scales is clear and appropriate enough that allow the participants to repeat the same test with same answer. But I don't know. What I don't know is whether these 10 questions are related to each other. Because in the content validity, I said, if the 10 questions are talking about stress, then the reviewers should agree on these 10 questions, right? And it is, to a certain extent, it's a bit subjective. It cannot give me some objective data whether these 10 questions are related to each other. If these 10 questions is all related to stress, should they be related to one another? Yes, they should be. What I mean related to one another is the participants answer question 1 with 5, for example. When they answer question 2, they should also give a rating 5 or 4 with a similar rating, right? Because both are about their stress level. But if the participant for question 1, they give 5, the rating, very stressful. But for the second questions, they give a very low rating that reflects they are not stressful. Do you think that there may be some problems with the questions? Possible. It is called inter-item reliability. What the inter-item reliability or internal consistency want to check is whether these 10 items are really talking about stress. And whether the subjects rate question 1 will give a similar rating to question 2, will give a similar rating to question 3, and so on. If so, that means the 10 items are really measuring stress. So the first point, the extent to which the items within a scale consistently measure the same variable. You see, the items in a scale consistently measure the same variable. It assesses the degree of consistency among the items. We talk about the items, the consistency between items. And then for checking the internal consistency, there are two tests we can do. Compare alpha is the commonest approach. And doing a compare alpha test is as common as test-retest reliability. It appears in over 90% of the paper. They use compare alpha. And compare alpha is a statistical test to assess how closely related the items are in the studies. So if you check the internal consistency using the compare alpha approach, we don't use R this time. R is correlation analysis. Compare alpha is different from correlation analysis, two types of different tests. Before this slide, I mentioned much about correlation analysis, R, right? But for checking the internal consistency, if you use compare alpha approach, then the symbols for this test is alpha. And this is the commonest approach we use to check the internal consistency and report in research paper. The higher the alpha value indicate a better consistency among the items in the scale. See the example here, and this is studies. This is a studies in 2018, and in these studies, one of the dependent variable is quality of life. And this scale, this is a quality of life scale. For this quality of life scales, there are 24 items. And among these 24 items, it can divide it into 4 domains, 4 different categories. Because you know, for quality of life, we have different domains. Physical domain, psychological domain, social domain, and environment domain. All these 4 domains explain quality of life of a person. And in physical domain, and for these researchers, they want to demonstrate the internal consistency of these quality of life scales. So how they do it? First, they give an overall score. You see the overall score here, 0.89. For compare alpha, the range of compare alpha is from 0 to 1 again. The higher the alpha, the better the internal consistency. And the researchers here do 2 things. First, they check the overall internal consistency of these 24 items. Because in this item, in total, there are 24, in these scales, in total, there are 24 items. So they check whether the question 1 is related to question 2, related to question 3, related to question 4, and so forth, using a compare alpha approach. And then they got the alpha, they got the compare alpha values 0.89. It is a good compare alpha. That means have the overall scale to 24 items is correlate with the with quality of life. Apart from that, they do one more thing, is they check the domain-specific compare alpha. Because for this scale, it is common for some scale, if the constructs have more than one domain, more than one component, then they will split the questions, they will categorize the questions into different categories, or they call it different domains. Like the quality of life here, there are 4 domains to explain quality of life. If we miss one of it, we cannot fully explain quality of life of a person. So that's why there are 4 domains here. And each domain, they have a specific numbers of questions. For example, the physical domain, there are 7 questions belongs to physical domain. 6 questions belong to psychological domain, 3 questions belong to social domain, and 8 belongs to environment. In addition to the overall internal consistency, the researchers also want to know whether the questions within a specific domain are also correlate with one another and also talk about that specific domain. So they do a domain-specific comparative alpha as well. It is very common for us to do so because we also want to know whether, for example, the 7 questions within the physical domain are all talking about the physical aspects of quality of life. So they have, apart from the overall alpha, they have another 4 alpha referring to different domains. For the physical domain, 0.61, psychological domain, 0.71, social, 0.65, environment, 0.78. For comparative alpha, above 0.7 is good or acceptable, we call it. If below 0.7, it is a bit marginal. It's a bit marginal. So for physical and social domain, in fact, the comparative alpha scores is a bit marginal, not very acceptable, not very acceptable. But still, the researchers want to use these scales, maybe because the overall scale, the overall comparative alpha is good, nearly 0.9. So they still want to use it to measure the quality of life because they use this overall score to determine quality of life in for their subjects, but not individual domain. That is comparative alpha. You must know comparative alpha, test, retest. You must know these 2 reliability tests because it's really very common to see in all research paper. Another test, not very common, but still want to introduce you is also checking the internal consistency of a measurement scale is split half reliability. Split half reliability. Don't mix up split half reliability with parallel form reliability. Students always mix up these 2. Parallel form, I developed 2 sets of test paper and then do a comparison. Okay, this is parallel form. Split half, as its name suggests, split half. I have 1 test here and then I split the test questions into 2 sets and then do a comparison. So I have 1 set of tests only. I have 1 scale here only. I split the item, maybe that scales have 20 items. I divide the 20 items into 2 groups. And then I ask the participants to fill in these 2 sets of items for me. After that, I do a correlation analysis. So for split half reliability, they do correlation. You see out here? Same correlation analysis I mentioned to you in previous slides. So if I want to demonstrate a good internal consistency, do you think that the R should be high or low? The R should be high, of course, the R should be high because I want to demonstrate a good internal consistency. And how to split the test into 2? There are many ways. Maybe you label the you number each questions, and then those odd number belongs to 1 set and the even number to another set, or you randomly split them into 2 sets. Randomly split them into 2 sets. The example here is to split the test, split the 6 questions into 2 sets randomly. So the first set in this scale only 6 items. The first set has 3 items. Item 1, 3, 4, and then another set of item 2, 5, 6, and then a group of participants complete these 2 sets of questions at the same time, and then we do a comparison. And the R is here is 0.87. Is it good enough? 0.87. Yeah, 0.87 is good. 0.87 is good. So we want a higher R values, which indicate good internal consistency. Split half, I seldom see researchers using split half. Maybe comparative alpha is really a very standard test that demonstrates the internal consistency. Okay, sorry. That's all the tests that I want to share with you today. So again, same as validity. After you know all these reliability tests, I think you are able to answer the question in the EPHPP whether whether the data collection of that studies is reliable. And what you need to know is the difference among these 4 reliability tests and how to do it, and what you expect for the R. There's one example here I taken from a paper, a research paper, and I extract this paragraph because it talk about the scale it used to measure the outcome. I would like you to spend 2 minutes to read this paragraph and then tell me what are the validity and reliability tests the researchers have done to demonstrate the psychometric properties of the scales. Do you understand the paragraph? Do you understand the paragraph? You must understand the paragraph because in test, I will also give you short paragraph. And I need you to identify the informations from the paragraph to answer the questions. I will not give you a whole research papers because it's only 2 hours and it is too much for you, but I will give you several or some or many, I don't know. I'm still thinking about it. Then you need to know how to read the paragraph and answer the questions. Have you finished reading it? Have you finished? Is it difficult for you? How difficult? Is it difficult for you? Really? Do you think, if you think it is difficult for you, you raise up your hand. What do you think? Is it difficult? Is it too much for you, the paragraph? Is it difficult for you? Do you understand the paragraph? You don't know how to answer, analyze it, and get the information from the paragraph. Yeah, I will tell you, no worry, but at least you understand the paragraph first. 明唔明啊？明唔明啊？呢個 paragraph 講咩㗎？咁上下 level 㗎啦，考試嗰啲就係咪好短啊？好簡單啊，嗬？咁上下嘅真係係咪？明唔明啊？你哋明唔明啊？呢個 paragraph 講咩啊？睇唔睇得明啲英文字啊？明㗎係嘛？明定唔明啫？唔明啊？你唔明啲 key terms 定係唔明嗰啲英文啊？你唔明咩啊？你話俾我聽，等我 adjust 一下個 test 先。我而家喺度揾緊，我揾咗好多翻嚟啊！我睇下邊啲啱你哋啊嘛。Okay, let's go through the paragraph here. The study questionnaire was developed based on the literature review and questionnaire from 2 previous studies with the guidance of the health belief model. You should know health belief model. In concepts of health, you should have already learned the health belief model. But the first sentence is not a major information. So no worry, even though you don't know what is HBM. Permission to use and modify the original questions was sought from the authors. I mentioned to you before, if you adopt other people's scales, you need to get permissions.
You need to get permission. It is research ethics. You cannot just find it in internet and then adopt it in your research without informing the original authors. The study questionnaire was also modified based on a panel of 4 experts in infection control and relevant research, and on the 2-week test-retest reliability among the 10 nursing students. So we end in this point first. So what do you think the test researchers have conducted? What do you think the test? There were 2 tests that the researchers have conducted based on this sentence. The study questionnaire was also modified based on a panel of 4 experts. What is this test? Modified based on a panel of 4 experts in infection control. It did a validity test. What is it? Content validity, because it mentioned about 4 experts in infection control. So the key terms I mentioned in my slide, you should memorize it, because it helps you to differentiate different validity tests. Every word I've written on the slide has meaning. Because I want to help you to digest, because I know research is a bit difficult for undergraduate students. Is it difficult for you? You're a senior student. I have a higher expectation on you. No? Usually it's a bit difficult for undergraduate students. So I try to make everything simple and state all the keywords on the PowerPoint to make sure you can differentiate the test from one another. So on the slide about content validity, I underlined expert judgment. We could expert, a panel of experts, not one, but a panel of experts to check the appropriateness of the questionnaires. So similar terms appear here again, a panel of 4 experts in infection control. So you will know it is about content validity. And on the 2-week test-retest reliability among 10 nursing students, they recruit 10 nursing students and then do a reliability test, and it is a test-retest reliability. And the interval of the 2 tests is 2 weeks, right? This time 2 weeks. So you should be able to identify these informations after reading the paragraphs. So what's next? The results, it tells you the results. Show that the questionnaire was valid and reliable. On what ground? You need to ask yourself. The author said the questionnaire was valid and reliable. Then you need to ask why. Any objective evidence? It has, because it tells the content validity index of 0.96. It's a very high index. It's a very high index, near 1. So it indicates good CVI, good content validity, and also the reliability of 0.94. What is this reliability means? Huh? What reliability? What reliability? What reliability test it refers to? It refers to test-retest reliability, right? Because before this result, they mentioned a panel of 4 experts and then 2-week test-retest reliability. So the following sentence is to follow up with the previous sentence to tell the result of the content validity and also the test-retest reliability. So a reliability index, that is the R, of 0.94. Is it good? Yeah, it's good. It's good. I give you the range here. For test-retest reliability, we use correlation analysis. That is R. If equal or greater than 0.7, acceptable, equal or greater than 0.8, good, equal or greater than 0.9 is excellent. So now the result is 0.94. So the test-retest reliabilities demonstrate an excellent test-retest reliabilities of this questionnaire. So next, not just test-retest, the authors also conduct an internal consistency test. What is it? What is it? It also conduct an internal consistency test. What is it? 佢做咗咩 test 啊 ？Do you know what is it? Do you know what is that test? Internal consistency? Yeah, Colbert Alpha， Colbert Alpha， 知唔知啊 ？Colbert Alpha， 睇唔睇到？佢後面寫住嘅 Colbert Alpha。The Colbert Alpha of the study subscale was reliable. Study subscale. Why subscale? You see this sentence? The Colbert Alphas. Once you see Colbert Alphas, you know the researchers has conducted an internal consistency. Check the internal consistency of the questionnaire using Colbert Alpha. And in this sentence, it gives you two pieces of information. First, the questionnaire subscale were reliable, ranging from 0.55 to 0.84. And then the overall Colbert Alpha is 0.82. What does they mean? 佢 mean 乜？佢都唔長嘅呢一句 Colbert Alpha 唔係得一個啫咩 what does it mean? Why the sentence so long? Should I have only one Colbert Alpha score? No, may not be. Because for scales, because I think the outcome of these studies is about infection control. So there are many aspects to comprehensively measure infection control. So the scales, in addition to an overall scale, they also have subdomain. Like the example I just showed you, the quality of life, they have 4 domains to fully represent quality of life of a person. So here the same for infection control. They have I don't know how many questions there, but at least all of these questions can reflect the infection control, maybe the level, the ability of a person. And at the same time, the researchers also want to know the level of infection control in particular aspects. So that's why they also tell the subscale score. Let's read the overall score first, 0.82. Is it good? Yeah, good. Usually about equal about 0.8 is good. 0.7 also okay, acceptable. But under 0.7 is marginal. And for the subscale score, some are 0.55 to 0.84. That means at least one, I can see here, is 0.55. Is it good? No, it's good. But maybe only one subscale have 0.55. But because the overall score is good, so that's why they still adopt this to use in their studies. And here I also tell you the range to let you know how to determine the reliability of the validity and reliabilities of the questionnaires that you see in your studies. One thing I can assure you is in the test, the levels of difficulties of the paragraph will be similar to this one. So if you understand this, it will be good enough and you will be able to tackle the questions. Key points here. Validity, face validity, content validity. These two, you must know how to do it and also the difference. Reliability, test, retest, all 4 reliability tests I mentioned. You should be able to differentiate one another. You also need to know how to do it and also how to interpret the R or the alpha. Okay, that's all I want to share with you today. One more thing before you leave is about the self-study exercise. I have uploaded the self-study exercise here and I will go through. There are 2. The first one is MCQ. I have developed 30 MCQ. And then the second one is case studies. I give you a research paper and then ask you several questions. And the purpose of this self-study, and I think up to this week, you will be able to complete at least half of the questions. And I will go through this self-study exercise with you in the week about consolidation to do revision with you. So I hope you can spend some time to read the questions. At this time, I didn't give you the answer because I want you to do some revision and do it yourself first. But I will go through the answer with you in the consolidation lectures. Okay, thank you. See you next week.